Minister, thank you for being in the House today. I think this is the first time I've addressed you since your elevation, so congratulations on that. You were a great senator when you were here, and I'm sure you're doing equally as well as a minister, so thank you for being here. Minister, I want to talk to you today about respiratory syncytial virus, or RSV. It's a common and highly contagious virus that affects the lungs and respiratory tract. While it can affect people of all ages, older adults, particularly those over 60, face a significant higher risk of severe illness, hospitalisation and death. Across Ireland and Europe, RSV contributes to tens of thousands of hospitalisations and thousands of deaths annually in this age group. Adults with underlying health conditions such as COPD, asthma, diabetes and heart failure are especially vulnerable. The rationale for introducing RSV vaccine for older adults in Ireland is clear: to protect this high-risk population from serious lower respiratory tract infections. Clinical trials of the vaccine, like GSK's trials, have shown strong efficacy, over 80% overall and more than 90% in adults with comorbidity alongside a favourable safety profile with mostly mild and temporary side effects. From a cost-benefit perspective, the Health Information and Quality Authority, HIQA, estimate the vaccine to vaccine all adults aged 65 and over would cost approximately $146 million for the 2025-26 season. It's important to say that the vaccine has a three-term span, so that's once every 3 years. Targeting those in the age group of 75 and older would cost around $76 million, while direct costs offset from reduced hospitalisation are modest, around $1 million. The broader benefits are substantial. These include fewer severe illnesses, reduced medical complications, and improved quality of life. RSV also exacerbates chronic conditions and disrupts daily activities in older adults. Vaccination could ease the burden on the healthcare system and enhance patients' well-being. International experience supports this, with yearly data showing promising reductions in hospital admissions following the vaccine. Specifically, there is research from Scotland which is absolutely astounding, the reduction in hospitalisation as a result of RSV, which we heard about last week in Boswell's Hotel. So in conclusion, the introduction of RSV vaccine for Irish adults over 60 is a sound public health measure, despite the upfront costs and strong efficacy, safety and potential to prevent serious illness and complications, especially among those with underlying conditions, makes it a worthwhile investment in protecting Ireland's ageing population. In the UK, the RSV vaccine is now available for adults between the age of 70 and 79 or 80. I think one day before your 80th birthday, you can get it, and it's free. It's important to point out, I inquired the other day to get the vaccine myself, because I'm totally convinced, having spoken to some people in Boswell's, that it's a worthwhile endeavour. Do you know how much it would cost? €235 for me to get the vaccine myself. So there's not much more I can say about it, Minister. I'm anxious to hear what the department has given you to say.
4 minutes.
Yeah, thanks very much. RSV, of course, as you said, is a common virus that causes respiratory infections, and the risk of severe infection is highest in very young infants. RSV is seasonal, with outbreaks typically occurring during the winter months, with the highest number of infections usually recorded in December and January. So every winter in Ireland, 1 in 2 babies will get RSV, and many will need medical care from their doctor or from the emergency department of a children's hospital. 4 out of 100 babies are hospitalised due to RSV, with some babies needing special treatment in intensive care units. So following on from the successful RSV immunisation Pathfinder programme, an expanded RSV immunisation programme is running throughout this coming winter. The immunisation will offer protection ahead of the seasonal upsurge in infection with RSV. Last winter, there was an estimated 57% reduction in emergency department presentations, a 76% reduction in hospitalisations, and a 65% reduction in ICU admissions compared to the previous year. And this supports and highlights just how effective immunisation has been in protecting our youngest and most vulnerable. So the immunisation is going to be given to all babies born between the 1st of September this year and 28th February next year. babies who are 6 months old or younger on the 1st of September, premature babies and other high-risk infants born during RSV season. And I encourage every parent to take up this opportunity to protect their young child's health. High uptake not only protects individual families, but also ease pressure on the health service over the busy winter period, allowing valuable resources to be directed to where they're most required. Immunisations will be administered to newborn infants in maternity hospitals until the end of February. For infants 6 months and younger, the immunisation is administered in clinics during this month. Further information is available at the HSE website, but I can confirm that a health technology assessment on RSV immunisation for infants and adults is currently being undertaken by the Health Information and Quality Authority. The health technology assessment will include advice to the Department of Health to inform a policy decision on the most appropriate strategy for immunising adults aged 65 and older. This health technology assessment will include an assessment on the clinical effectiveness, the cost effectiveness and the budget impact of alternative strategies for adults aged 65 years and older against RSV. This will also consider the organisational, resource, ethical, patient and social implications associated with alternative strategies. The outcome will inform future decision-making in this matter in relation to whether or not any amendments are required to our national immunisation programme.
Thank you. Minister Senator, you have 1 minute.
Minister, thank you very much. Indeed, the results from the children, and I hear that the take-up isn't as good as you and the department would like. So I would encourage parents like you to get their babies immunised as quickly as possible. But the last paragraph of your speech is the one that really counts for me. People over 65 years of age, there are an equal number, if not more, elderly people being admitted to hospital with RSV, and many of them die as a result of it. So let's hope that we get that research and advice from the department as quickly as possible and see a rollout for the over 65. So I thank you for your time, Minister, and I thank you for delivering the results.
Thank you. Minister.
I mean, vaccination is one of the most cost-effective and successful public health interventions that exist. And it's just quite discouraging to see so many people sceptical about vaccines. And there's never a scepticism about a new curative drug. Oh, please, we need this drug as soon as possible. But a vaccine, people, don't know what's wrong with that. When you look at the statistics, it's incredible. The lives that have been saved. The cervical cancer, for example. It's going to end because of the vaccination programme. In the future, with all the immunisation that's happened since 2010, I think, all those young women and then young men as well who started it at a later point will be immunised. And there are so many other examples as well. So look, the immunisation programme in Ireland is science-based. All of this is science-based. You've outlined science as well. We have this National Immunisation Advisory Committee. The recommendations are based on the prevalence of the disease and international best practice. And it's vitally important that this is robust and fit for purpose. And that's why this health technology assessment is so important. And it is just really important to do this assessment. And the outcome will inform the government decision on this. And I do agree with you. Please get your child vaccinated if the child is eligible. We can see the hospital admissions that are reducing, people and children not dying, more importantly, but also massive pressure on the hospital system not being there because of this. So the vaccinations in this area, like so many others, have had such a positive impact. We need you to get your child vaccinated for RSV. It'll be one thing that I think your child will be very grateful that you did. Gerard.